Good morning, everyone. My name is Maisha Hutton, and I'm the Executive Director of the Healthy Caribbean Coalition. And we are delighted that you've joined us today for our 7th Annual Caribbean Alcohol Reduction Day, or CARD as we fondly refer to it. We are very happy to present a wonderful panel of experts from across the region to share with us their experiences around alcohol prevention. And this year's theme is the WHO Global Alcohol Action Plan 2022 to 2030, and really looking at priorities for the Caribbean. I'm going to hand over to our alcohol technical advisor, Professor Rohan Maharaj, to provide a few brief introductory remarks, and then we will go over housekeeping and get into the panel. Over to you, Rohan.
Yes, good morning, everyone. Thank you for joining us today. We know that you have a lot of competing interests as World Cup soccer, and thank you for taking your time off to come and spend this hour or two with us. Over the last few years, the Healthy Caribbean Coalition has endeavored to raise the awareness of alcohol in the regional environment. And we've done that through primarily talking about things like alcohol and cancer, alcohol and youth, the alcohol and women's health, and last 2 years ago, alcohol and COVID. But this year, we're taking a slightly different approach to the webinar, in that what has happened on the global stage has been the declaration of the World Global Alcohol Action Plan by the World Health Assembly and the World Health Organization. And we thought, listen, this is something that is quite significant, and we wanted to ask our international collaborators to give us a perspective on this. So how did this come about, and what are the implications for our region? And so that's where we will be taking you today. We also have a regional colleague from Jamaica, Mr. Tucker, who is a representative of the Ministry of Health, the Executive Director of the National Council on Drug Abuse from Jamaica. So we have a representative of PAHO, Dr. Maristela Monteiro, a representative of the Global Alcohol Policy Alliance, Dr. Oystein Bakke, and we are all going to hear the perspectives of this global event in terms of how this is going to impact on us in the West Indies and the Caribbean, and what can we as civil society do to make sure that our governments, our regional authorities, our regional civil society take advantage of this new action plan and the implications of it for our region. So thank you very much for this opportunity to introduce our seminar today. I hand you back to Maisha.
Thank you, Rohan. We're now going to play a video introducing the webinar. In terms of the housekeeping, it's not all of the comments apply, but we really wanted to share this very unique video with the audience. Here we go.
I'd like to give you a few tips on. Hello everyone, hola, bonjour, hola. My name is Paula and I work with PAHO to educate people about the harms and effects associated with alcohol use. Before we start, I'd like to give you a few tips on your participation in today's session. First, please make sure your microphone is muted. If you are asked to speak, please unmute yourself by clicking the microphone icon again before you start speaking. If you want to speak, please raise your hand by clicking on the hand icon. You can also type your questions in the chat or use the Q&A tool if it is available for this event. Add your name and affiliation before asking your questions or posting in the comments section. If simultaneous interpretation is available for today's session, click on the interpretation icon and choose the language that you would like to hear. Don't forget to click on Mute Original Audio to hear only the interpreted language. And finally, this session may be recorded. We are now about to begin the event, but I can't leave without inviting you to visit. I would love to interact with you, anonymously and without judging. I can provide you with reliable information about the impact alcohol can have on your health and help you to assess and reduce your risk of alcohol harm. I can also support you on ways to reduce the alcohol consumption risk of a loved one and present the public policies available to reduce alcohol use. You can reach me through the web address at the bottom of the screen. See you soon and enjoy the event.
Thank you, Paola. And you'll be hearing more about Paola from Dr. Monteiro in the next presentation. We thought that was really quite excellent and innovative, and we wanted to share it with the audience. So now I'm going to hand over to Dr. Maristela Monteiro, who is the Senior Advisor on Alcohol and Substance Abuse at PAHO. Maristela, over to you. I think you're muted. Yes.
Yeah. Didn't follow, Paul. Thank you very much. I was proud to hear Paula speaking and explaining the rules of the webinar today. Also, today is a very important day for the Pan American Health Organization. Its 120th anniversary of today, and we're very proud to be the oldest public health agency in the world. And I'm going to present very briefly some components of the Global Alcohol Action Plan. As Rohan informed, it was adopted by all member states in May of this year, and it goes until 2030. So there is a role for everyone to play from now until then to make a difference in the world, in your countries, and in alcohol harms. So let me share my screen here. I think before that, I need to, where do I put the share? Is in the apps, the share sound?
Yeah, it should be on the bottom of the screen. When you go to share on the left-hand corner, you should see a little box that says share sound.
Oh yeah, is in the same.
Great.
I don't get that. Let me see. Okay. I got that.
Great.
And now sound on. Okay. So can you hear? Can you see my screen and the presentation?
No, not yet.
No. Then let's go back and share again. Oh, I didn't click that.
It's starting. Great. We just need you to go full screen now.
Yes.
Perfect.
Sorry about that. Okay. So here we go. Let me move now, see if the slides are working. Yeah. Okay, here. So the Global Alcohol Action Plan is a result of several years of consultation process and discussions from beginning with technical experts, then with regional advisors across the globe, and then official consultations with national counterparts in every region on the first draft, on the second draft, and then public consultation with all stakeholders, including economic operators. There was a discussion and presentation to them as well. And at the end in May, when this was presented, it was approved without any change, which is quite rare to happen. The whole text was approved as presented. And I think it gives credit to a lot of work that was done ahead of time. And this plan now is linked to and align with all the other mandates and global plans that have a relationship with alcohol, either as a risk factor or as a disease. So we are aligned with the political declaration on universal health coverage, on the mental health plan that was also adopted until 2030, the non-communicable diseases global action plan, the political declaration of the UN General Assembly, and now the global plan on addressing interpersonal violence, on traffic safety. So all the plans that and strategies, resolutions related to alcohol somehow use the same principles, and hopefully it will be, with the same goal, and trying to move forward the idea and the proposal and the target to reduce alcohol harms and alcohol consumption everywhere in the world. And it has 6 areas of action. The first one is giving a higher priority because it is focused on the implementation of high impact strategies and interventions. But of course, to make that effective, you need advocacy, and it's a second area, awareness and commitment. That's where NGOs can have a role as well. Partnership, dialogue, and coordination with different stakeholders, other UN organizations. Just this week, there was the first consultation with other international organizations of the UN system. Quite broad. Technical support, capacity building, the knowledge sharing and production that we need to understand alcohol harms, but also how we're making progress, and resource mobilization. I don't know what is. Why it doesn't move? Is okay. And it has 11 global targets, leading to 16 indicators. Most have been defined, but not all the indicators specifically on how they'll be calculated, how they're going to be used. But I give just an example here of the targets. It is now more ambitious than the only target before, that it was related to NCDs of a 10% relative reduction in harmful use of alcohol, and now it is at least 20% relative reduction. And the baseline is still the same, is the year 2010. And then it goes to most targets relate to countries doing things. So introducing, enacting, maintaining the implementation of high impact policy options, developing national written policies. I think most countries in the Caribbean region do not have a national written alcohol policy, so there is work there to be done. Establishing national multi-sectoral coordination mechanisms, engaging with the networks, and we have developed in PAHO the Pan American Alcohol and Public Health Network, the PANAF network of focal points, and now we're going to push for next year to meet again and bring the focal points together, and this should be regular and regularly done, and also in consultation and in collaboration with WHO, that will also have a global council. And it goes on. There is no time to go over all the global targets here, but going back to that first area of action that relates basically to the implementation, as I said, of the high impact strategies, and the package that WHO released in 2018, and it was a topic of a card day already, is the SAFER initiative. And SAFER is an acronym of of 5 most cost-effective interventions, and the push is really to get countries to develop the policies, implement well, and make a difference by using these policies above all to reduce consumption and harms from alcohol. The global plan also is a very long plan, and because it has actions, messages, measures to several stakeholders, and it ends up being over 50 pages, I believe. WHO is finalizing now a publication of the plan, and what we decided to do was to summarize what for each stakeholder, what's there for them. So it's now available online in the PAHO page, a fact sheet for member states, what are the actions that they agreed they will take. NGOs, academia, so civil society, there are a list of actions that they can take, and also for economic operators, because actually they are called different. It's not actions but measures that they can take, because as you're going to see, the bottom line for them is what they should stop doing and not initiating. So their contribution is to stop the actions that have been preventing the effective policies to be developed or used to the benefit of people. And their strategies, their tactics, lobbying are a major barrier identified by member states, by Ministry of Health, Ministry of Finance, and by NGOs as well, as impeding progress in alcohol. And there is another stakeholder is obviously the WHO Secretariat, but I thought when we planned this that this is more internal than for the external world. But of course, it is one of the main purposes of the plan is to guide the Secretariat on how they can help countries achieve the indicators and the targets set up. And we developed also a fact sheet to summarize all the indicators, those 16 indicators that by area that have been adopted, including per capita consumption, as you've seen before. Evidence-based and knowledge sharing information is essential to use what really is informed by the best scientific evidence. So we also developed, and we still have 3 almost done, and they will be published before the end of the year, fact sheets based on the alcohol no ordinary commodity, the new edition of it, and we worked with the authors to summarize the key areas that relate actually to SAFER as well. So we have already out on alcohol affordability, on the availability, physical availability of alcohol, on health services. We added one on the SDGs, how alcohol relates to the SDGs, and we're finalizing all of them in 4 languages on drink driving countermeasures, what is the latest evidence on alcohol marketing, and a new one that we thought was important because we always talk about what works, but it is important to remind people what doesn't work, and people should stop investing vast amount of money on programs that do not work, and that is based on hundreds of studies as well. So it's also being finalized now for publication. So what are the new opportunities coming up? First, WHO has an initiative on accelerated action for impact. So that is direct support to a number of countries and get the buy-in on the policies that they can effectively implement. So this is being discussed now in every region. A number is a small number of countries, but there'll be direct support from headquarters working with the regional offices on those countries. We have the SAFER initiative that is also now better funded in WHO, and there'll be support given also to those countries interested in implementing those policies. The vital strategies came up, it will receive a large funding on to implement SAFER basically, but it was another acronym that they're using, RESET, and it is with a focus on taxation, but any other of the policies of SAFER are also good, and some countries will be supported. NGO capacity building will be supported through that as well. And there is also currently open until I think mid-December from the Alliance for Health Policy and Systems Research. There are open calls for implementation research and policy related to NCDs and risk factors. So this is another opportunity to get some resources to work on those policies. So now, as I was asked, in terms of awareness, we launched a new campaign this year, which is focused on the safer policies. Oops, sorry. And let me show you the video. Let me know if you can hear. It's not. Why is not playing? I don't know. Anyway. Sorry. Can anything be done? This is an embedded video.
Maybe what we can do, Maristella, is see if we can sort out the video to play. And once we get it, I'm not sure.
Let me see.
Usually there's a play icon. There you go. There you go.
You'd be right if you say they are intoxicated. But what if I told you that we all have a drinking problem? No matter how much you drink, one thing we can all agree on is that alcohol can ruin lives. When we consider liver disease, road injuries, violence, cancer, cardiovascular disease, and suicides, alcohol is responsible for taking the lives of over 3 million people every year. Yet, it is available almost everywhere at any time, branded and marketed to every demographic, and it's cheap.
Fuera de aquí. Vamos, fuera.
Even if they don't have ID, they can always just buy drinks online. We pretend that these ads are harmless or somehow good for the economy. But have we stopped to consider the real cost? Who is really profiting? Me? You? I wonder. As even governments lose badly as their revenues are a fraction of the real costs. Maybe those who lobby and challenge the regulations designed to protect us have a vested interest. We want our communities, our health, and our lives to be free from commercial interests. If we want to see change, then we have to push for policies that protect people. Enough is enough. It's time to take action.
And here is Paola.
Hello, I'm Paula, a digital health worker programmed with the latest information on the effects and harms of alcohol. I'd love to chat and see how I can help you. Just scan this QR code to get started.
This is a new way of disseminating information, Paola. And Paola is a digital health worker based on artificial intelligence. She has a human-like face and she talks, as you could see, with empathetic way, emotions, and she can perceive emotions from the video of the person interacting with her, but it's all anonymous and confidential. No information is kept from anyone that in a way that can identify them. And she speaks 4 languages and it can be used on any device, any time of the day, an unlimited number of times. So as you saw in the beginning and the brief video, she can talk about over 100 different topics on alcohol. She can screen for alcohol use disorders using the audit, and then based on the results provide a brief intervention guiding people through a motivational interview, and also refer people with very high risk or they are willing to go for treatment to a health service in their own country. There is linked to another page, and country by country we put it free health services available, including those of AA, and also providing and having a dialogue for those interested in others and helping others or a family member, and not because they have themselves a problem. And this year, the new version of Paola also includes alcohol policy information. So Paola can talk about what really works from a public health perspective. So here is the promotional video.
Hello, Paula.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos días.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paula. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you through a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
Okay, so Paola, the first results of last year were seemed a little disappointing at the end, even though she had a tremendous appearance in social media. At the end, there were several issues on the interaction with Paola that didn't work properly. People were using mobile phones and they couldn't see her face immediately. It would take a lot of time to download. So we fixed all that this year, and we already have about 5 times better performance with Paola and many more people interacting with her. And we have a campaign ongoing, social media, that is going to go until April of this year. And we're working with a few countries. They're testing and putting the same link in a page in their website. And for example, Belize is one of the countries, and with the National Drug Control Office, and they create a page. There are links there, and we're gonna see what it will be. They're gonna use social media there also to drive the traffic in Belize, for people to try and use and be better educated about alcohol harms. And we'll be able to see if that is a good strategy, because at the end, we want this to be a tool for countries to use the best way they think it can be used. And finally, we have all these virtual courses available free for anyone to use. And we have 2 new ones. We have one on the Safer Initiative, and we have one that is more limited, but still very useful and important, on how to calculate the alcohol per capita consumption in 3 languages. And I put here some data. It's a little old, but maybe until mid of this year, on the number of people that have been using these virtual courses. So there is a lot of information, and with the fact sheets about the global plan, ideas that people can use, NGOs and especially member states, to start changing the clock and improving the lives and extending the lives of people in the Caribbean. Thank you very much.
Thank you, Maristella. We must congratulate PAHO for this excellent work that you've done, from repackaging the Global Action Plan into these fact sheets, which are accessible and clearly help to articulate to us as advocates where the priorities are. And also, I think I stand with everyone else in that fantastic campaign video. We have a question from CARFA's communication manager, Carlin, on how can they access the video? So I don't know if you wanted to answer that really quickly before we move on to our next speaker.
Yeah, the video is in the YouTube channel of PAHO, and it's free to be downloaded and used in 4 languages as well.
Great, thank you. And finally, I think Paola is such an excellent tool, the non-judgmental access to information. And I urge any member states that are on the call now to reach out to it. I love that Belize is putting Paola on their national webpage, and I would like to see that number increase. So thank you again, Maristella, for all the work that you're doing in this area, which is often forgotten, but yet a very important area.
Thank you.
You're welcome. So now we're going to move on to the Global Alcohol Policy Alliance, and Oystein Bach, who's been a friend of HCC for many, many years. And we're really pleased that you've taken time to present with us here today. Oystein, do you have sharing privileges?
I do have. Thank you. Thank you for having me in this session. I really appreciate the opportunity. And let's see if I can get my slides up. Do you see it now?
Yes, we can see them and we can hear you.
Very good. So thank you very much. My name is Oystein Bakke. I'm talking to you from Oslo, Norway, so quite outside of your region, but I'm still happy that you invited me to this. I work in an international development organization in Norway called Forut, which focuses on alcohol and drugs as development issues and is quite engaged in alcohol policy work, allocating part of my time to function as the secretary of GAPA. So it's with the GAPA identity, or the GAPA hat, I'm talking to you today, and I'm trying to give some perspectives on the Global Action Plan. And thank you, Maristella, for your great introduction. Saves me a lot of talking since you gave the outline of it, and also happy anniversary to PAHO. So what I'm trying to cover over the next few minutes are some perspectives on the process leading up to the approval of the Global Alcohol Action Plan at the World Health Assembly, and some perspective on challenges and opportunities for implementation of the plan. The illustration I have used here is actually what the action plan looks like at the moment. It's still only available in the form of the document which was presented at the World Health Assembly. We are waiting for the signed version of it, and I'm happy, Maristella, to hear that it's available, and also to learn that PAHO already have more information accessible, more accessible information available about it. The background, I want to go back to 2010. At the World Health Assembly that year, the member states endorsed the global strategy to reduce the harmful use of alcohol. And it started a period where alcohol was back on the agenda and back on the public health agenda of the World Health Organization. And one of the things that came out of it was the SAFER initiative that was launched in 2018. But there has been throughout a lack of resources for implementation of alcohol policy, and that goes both on the global level, and the national level, and civil society level. Very little resources have come to this area. And thus there was also an acknowledgement that implementation of the global strategy had been slow and uneven. So in 2019, there was an initiative taken, but let me point out a bit about what is the global situation leading up to the passing of the action plan. What we even with the WHO global strategy, what we have been seeing is an upward trend in alcohol consumption globally. Looking at the goal set by WHO in 2011 as a part of the NCD process, the goal was for reduction in per capita consumption of alcohol, but this is not being met. Researchers have assessed the developments between 1990 and 2017, and they have made forecasts for the future. And they see that the opposite of reduction in per capita consumption is happening. High-income countries see fairly stable development, but the big rise is in the middle-income countries and somewhat in low-income countries. And these middle-income countries have some common characteristics. Most of them have quite young populations, increasing expendable income. They are exposed to globalization trends, and which includes a decline in traditional factors that might limit alcohol consumption. And generally, there's quite a lack of policy measures to control alcohol. So in these countries, we also see that governments are largely failing to put in place effective alcohol policy measures. A study of NCD policies in 194 countries show that alcohol policies are poorly implemented, actually among the sector which is worst off in terms of implementation. And especially a Best Buy like the alcohol marketing is hardly being implemented. Restriction on alcohol marketing is hardly being implemented anywhere. And these alcohol policy measures actually fell in implementation between 2015 and 2020. And these countries are also the ones being targeted by alcohol producers. They use marketing and PR tactics, and increasingly advertising is happening in the digital space, in the social media. They are helping to increase the availability of alcohol through the expansion of retail outlets, for instance, through global chains of convenience stores. And in addition, they are active in the alcohol policy space, trying to limit adoption and implementation of evidence-based policies. So with this background, we think that there is an importance of intergovernmental response, and taking this to the World Health Assembly is such an example of an intergovernmental response, because marketing is global, the industry is transnational, and the trade and investment agreements are being used as leverage. That is a point which we probably could talk about as a separate session. So during the period from 2019 to 2022, there was the development of this global action plan. It started with a call from member states to actually try to put more action into the alcohol policy field. And the DG committed, that's the Director General of WHO, committed to make a report on 10 years of the global strategy and the way forward. And that started a consultation process. So everybody was invited to comment to give input for that report, including civil society, and many of us were quite active in that process. And that report was submitted to the WHO Executive Board in 2020. And the board reached a decision to develop an alcohol action plan. And that started another period of consultations, 2 years with consultations on various drafts of the action plan. And as Maristella pointed out, that was recommended for adoption at the Executive Board in 2020 and unanimously adopted by all the member states, members of the World Health Assembly in May this year. So it was reached with consensus, which is very good. And as Maristella pointed out, sometimes that is very often not the case. So we were quite excited to see the developments and interested to the very last minute whether this would pass or not. And GAPA, along with regional alliances like the Healthy Caribbean Coalition and other regional alcohol policy alliances, were involved throughout the process, both with making submissions to the consultations and advocating towards member states to adopt a strong and meaningful action plan. And for those who are interested in more details on this, they can look up the GAPA website, where we have this background story where you can read various developments through the process. But not only the civil society was involved, also the industry participated actively, both in the consultation and, as we know, in lobbying member states. They argued for inclusion of industry and was rejecting a framing of an inherent conflict of interest between public health and alcohol industry, though that is pointed out in the action plan quite strongly, and it's one of the things that we are happy to see on paper in the plan. They also argue that the action plan exceeds or contradicts the global strategy and or WHO remits, claiming it went too far. And they argue that the focus of alcohol policy should be on the reduction of harm rather than consumption per se. They are generally rejecting the per capita consumption measure, which is a measure that has a very strong evidence and which is agreed by all researchers in the field is a very valid measure to use. So looking at the challenges and opportunities, or the pluses and minuses of the outcome of the action plan, we see that the action plan has a very good background section describing the problem and as I said, mentioning the conflict of interest of industry and things like that. It has a good overarching goal, as mentioned by Maristella already, and has this clause about the need for protection from commercial interest as one of the principles of the action plans. And it points to regulating marketing and other best buys, though you will see on the negative side, I have put that there is not a strong enough focus on the best buys and safer. The document is very long, and even if most of the best buys and the safer measures are covered in the plan, they are kind of spread out and a bit difficult to extract from the document. And then on the positive side also, there is a very strong focus on public health-oriented alcohol policy. Alcohol policy should be made to protect health rather than promote investments. On the negative side, we were not so happy to see that the economic operators, which is the term used basically for alcohol industry, is given a measure in each of the action points. But that is something that was not possible to avoid, and many of these measures are very strongly pointing actually to what the alcohol industry should not be doing. But we know from experience that they will use this to claim legitimacy and to claim that they are a part of the WHO process in this regard. And the same goes for this clause, which invites the economic operators to develop and enforce self-regulatory measures, which we know are not effective, but still that clause remains in the action plan. And what are the opportunities? I think it has already been mentioned, the best buy policy options, the safer measures. So time is flying, so I will not go into detail here. But looking at it from the Caribbean region, it might be interesting to look at what you have and what is not there. And I think that among the issues that at least I can see from the statistics and from WHO reporting, they might not be accurate, but I think many countries in your regions do not have age limits or have a fairly low age limit of 16 years, where 18 is more common, and some countries even have higher age limits than that. So that might be something to look at. Also, the restrictions on hours of sales and density of outlets, number of outlets, these things can be addressed. And in the road safety matter also, I think many of your countries have a 0.8 limit, while lowering the blood alcohol concentration limit is a best practice, particularly when it is enforced through random breath testing. So these are some options that could be explored. And I have also added the picture here of a technical report that was requested along with the global action plan, and which was published just prior to the World Health Assembly. It's a technical report from the World Health Organization on reducing harm from alcohol by regulating cross-border alcohol marketing, advertising, and promotion. This report draws attention to a big challenge, and it's absolutely an opportunity to build on the information in this report for more cooperation around reducing alcohol advertising. Watching the ongoing World Cup, FIFA World Cup, we experience that alcohol advertising really is a global issue. So finally, civil society involvement is important, and I'm using that as a hook to advertise for the Global Alcohol Policy Conference coming up in October next year. It will happen in Cape Town, South Africa, and it is an important meeting place for researchers, policymakers, and advocates and practitioners. Sorry. So hopefully I will see some of you in Cape Town next year. Thank you.
Thank you, Oystein, for painting that global picture, and Maristelle as well. So now we're shifting to the regional, and I'm going to invite our alcohol policy advisor, Professor Maharaj, to share on kind of a status update on where we are with alcohol policy implementation in the Caribbean.
Okay, thank you very much for all of the presentation so far. I hope you can hear me very well.
We can hear you, Rohan. Maybe just get into slide presentation mode.
Right.
Seeing,
Are you not seeing my slides?
We're seeing your slides, but they're not in presentation mode.
Okay, got you.
Yeah.
Thank you.
There you go. You're welcome.
Right. Better? Right. So as I started to look around at what was happening, I felt that it was important for us to look back a little bit on what things have been going on for the last couple of years. But I also always, as for those of you who remember, over my last couple of years, I've tried to bring it personal. And, you know, only yesterday, my wife gave me this news about a distant relative, a 54-year-old East Indian male who was dead from the complications of chronic alcohol abuse. And it just struck me, you know, so little is being done for our populations around the region to protect and educate and to inform our population. This young man leaves his mother, his wife, and 2 children behind. And, you know, despite all the efforts and so on of organizations such as ourselves in trying to raise awareness, this continues to be a big challenge to our population. So trying to just draw it personally, we've talked about global and regional policies and so on, but I think we always have to remember that this is a very personal type of loss that goes on with alcohol. As I look back, there has not been any significant change in policies around the region. And I have been looking at this through the PAHO's web pages over the last 8 or 9 years. This was a slide that we created for our 2nd annual reduction day back in 2017. And this basically is where we're still at, that we've had some actions on excise taxes and so on. There is almost no ban on or comprehensive restrictions on alcohol advertising, and there's almost little or no restrictions in physical availability. For example, in Trinidad, we continue to see many of the alcohol outlets advertising to be open any day and at any time. So this continues to be a real challenge. So we continue to see our governments. This was a little bit dated, but nevertheless gives us a flavor and a much
Sorry,
more
Rohan, to
recent.
interrupt you, apologies, but your slide deck's not moving through. We're still seeing your title slide and it's not on slide presentation.
Okay, I'm not sure why that's happening. Okay,
I'll tell you when we go into presentation mode, because we're still seeing your title slide.
Okay, I'm not sure why that's happening. I'm still seeing here that only one participant can share at a time. Can you change that from your side? Multiple participants under the green box from your side is.
Tell me what you're seeing.
I'm seeing only says one participant can share at a time, and we've been using multiple participants. So sometimes clicking on that button can make a difference. Under the green button saying new share, click the second one.
Yeah, it's clicked.
It's clicked. All right, let's try again. What about now?
Do you want to try to just close that down and open it up again?
Let me close it and restart, yeah.
Stop sharing first. There we go. And then you can reshare.
How about now?
Okay, now try and go into presentation mode.
Any better?
Okay, try and advance to your next slide.
No.
No, it's not working. Do you want to send me your slides, Rohan, and I can do it from this end and you can continue speaking while I wait for them to come in?
Okay, so you'll have to close off this.
Apologies, everyone. Technology doesn't always work the way we'd like it to. Oh, there we go. I can see, yeah, we can see an image of Prime Minister Motley.
Okay.
Okay, it's working. Great.
Okay. So basically the point, let's see, hopefully does this progress now?
Yes.
Okay. So the point I was making is that we continue to see our leaders being very focused on the alcohol industry, seeing it as an integral part of both the legacy of the Caribbean and an economic, strong economic driving force within the region. We've also seen challenges within our healthcare system, where even our healthcare workers at very high levels don't see that their involvement with alcohol industry as being any sort of conflict of interest. And this was something that happened last year, where one of our institutional principal medical officers was appointed to the board of Angostura and was supported strongly by the Minister of Health. We've seen the challenges within CARICOM of the CARICOM private sector organization, CPSO, which has been given a role almost within the board of CARICOM to have an impact on things like mergers and acquisition, package labeling, common external tariffs, and food security. And this organization is basically a part of the economic operators, as we've been referred to. And we're starting to see reports coming out, and this one coming from Jamaican Gleaner, which talks about the front of packaging label conundrum, where the private sector is delaying the process of impact assessments and so on, and delaying the changes that need to happen, certainly in the food industry. So this organization, the CPSO, is already having an impact, and this is at the highest level of CARICOM, right? There are a few bright spots, and we will all recall our Minister Tufton from Jamaica, who we'll hear a little bit more about the Jamaican situation in a few minutes, had a role in protecting the health sector from big alcohol interference during the COVID pandemic, right? We've seen some opportunities working at HCC that there has been some discussion about the development of written alcohol policies in Jamaica and Guyana, and we will hear a little bit more about that. But these have been not as clearly forthcoming as we have anticipated, and there seems to be a constant pushback by the alcohol industry to influence policy and derail regulations and laws, right? So that's why we really look forward to and have been looking forward to hearing about the whole idea of this global alcohol action plan, because this is something that has been promoted since the beginning of this year, the World Health Organization, and we've been seeing the news coming through. Yet it's important to hear that all of our countries, this was accepted unanimously. So it means that all the countries within the region basically said, okay, we support this. And I was able to hear one of our colleagues from Jamaica saying that the Jamaican government in the deliberations at the WHA said, World Health Organization and World Health Assembly, saying that they supported the plan. So it means then that we have a tool, we are saying civil society, have a tool in which we can approach our governments and saying, well, you've signed off on this, what's happening, right? So this is where I think in terms of policy, we see some of the biggest openings occurring. And I think for all of us who are interested in this area, we need to understand how we can really operationalize the ideas and the hopes of such a document, all right? Despite all of this, so this is the reason that we brought this seminar and webinar together for you all today. And in conclusion, the alcohol industry continues to interfere with a lot of national opportunities and so on and developments around the world. We need to be aware of how this is happening. We're starting to see it happening within the region. We sometimes are unaware of it, but they are situating themselves very, very strategically within places like CARICOM and certainly within our governments. And we need to be able to recognize this and try to use the opportunities coming out of things like the World Health Assembly, the World Health Organization, to sort of address and balance off the effect of alcohol against our population. Thank you very much, Maisha. It's not very many new things, but again, just providing a little bit of a taste of what's been happening in the region. Thank you very much, everyone, for listening.
Thank you, Rohan. And now we're going to shift to the national level, and I'd like to invite Mr. Michael Tucker, who is the Executive Director of the National Council on Drug Abuse in Jamaica. We're delighted to have Michael with us today. He's new to the HCC, and we were really excited when he agreed to participate in this webinar. Over to you, Michael. Do you want to go ahead and share your slides, and I make sure that they are visible on this end?
Is that good?
Yep, we can see them. Thank you. Go ahead.
Okay, let me just thank you, Maisha, and the Healthy Caribbean Coalition for giving me the opportunity to share today. So I'll just go through very quickly the outline of the Jamaica's national policy for the reduction of harmful use of alcohol. Why is it moving?
Try just clicking on the screen and see if it moves ahead. There you go.
Okay, all right. So, all right, in terms of looking at the presentation outline, we're looking at international and local context, alcohol use and risk factors, looking at rationale for the alcohol policy development, looking at alignment with local and international strategic goals, and also objectives and components, looking at scope and achievement strategies. So at the international context, we're aware that alcohol is one of 4 main risk factors for non-communicable diseases and a leading risk factor of disease burden, both for mortality and morbidity, and it's linked to numerous negative health and social outcomes. We know there's also a link to cancer, strokes, and cirrhosis of the liver, linked to mental health problems, including depression and anxiety disorders, obesity, and unintentional injury. And also in 2016, 2.8 million deaths were attributable to alcohol use globally. Alcohol use was also ranked as the seventh leading risk factor for premature death and disability in 2016. So what our local context is. So recent national studies have shown that 15% of Jamaican population aged 12 to 65 years with a medium to high risk of alcohol dependence. That 7 out of 10 reported that they had consumed alcohol at some time in their lifetime, and 4 out of 10 were current users. Among students 13 to 15 years old, they reported drinking alcohol before the age of 14. And there was easy access and availability of alcohol. Over 50% of our youth reported that there was easy access and they had any problems whether they had on uniforms or not. That's a rationale for the alcohol policy development. We know that policy advances the efforts to achieve the government's vision 2030 and also a national development plan. So when you look at goal 1, Jamaicans are empowered to achieve their fullest potential. Goal 2, Jamaican society is safe, cohesive, and just. And we know that policy also seeks to advance Jamaica's attainment of sustainable development goals. So goal 3.4, by 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and to promote mental health and well-being. We have goal 3.5 to strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. And 3.6 by 2020 to halve the number of global deaths and injuries from traffic accidents. So rationale for alcohol policy development. This policy aligns with key local and international plans and recommendations. So we have the plan for National Council on Drug Abuse, our strategic plan 21 to 25, the National Strategic and Action Plan for Prevention and Control of NCDs, 2013 to 2018, World Health Organization's Global Strategy to Reduce the Harmful Use of Alcohol. We have CDC's Preventing Excessive Alcohol Use, a plan to prevent excessive alcohol use, and United Nations Office on Drugs and Crime, their plan for evidence-based drug prevention strategies. So what are the policy objectives? Objective 1, to look at availability, to effectively regulate the availability and accessibility of alcohol products. Want to effectively regulate alcohol advertising, promotion, sponsorship, and particularly those advertisements targeting our youth. Want to strengthen health services and community responses to the harmful use of alcohol and thus prevent and minimize the negative health outcomes for those affected by alcohol consumption. Want to reduce the impact of alcohol and prevalence of communicable and non-communicable diseases, including interpersonal violence. Want to increase a common understanding of the impact and scope of alcohol-related harm to Jamaican society. To effectively regulate and enforce driving laws in compliance with the World Health Organization recommendations on blood alcohol content. To reduce road traffic accidents due to drinking and driving. Want to develop a comprehensive, coordinated, effective approach that builds on past and present efforts to prevent and reduce alcohol-related problems. To multiply and strengthen collaborative partnerships among governmental and non-governmental organizations, addiction agencies, and communities affected by the harmful use of alcohol. And finally, to monitor, evaluate, and conduct public health surveillance and research on harmful use of alcohol and national responses. So what are the policy components? One component is pricing and fiscal measures. We're looking at physical availability of alcohol, looking at marketing and advertising of alcohol products, drunk driving countermeasures, preventing the sales to minors. We're looking at liquor law enforcement and controlling illicit alcohol. Also, our health system response, we want to bolster that. Education and information is key in what we're doing. We'll look at capacity building, especially the health system to deal with alcohol misuse, and of course, our monitoring and evaluation. So once this policy is implemented, what are the expected outcomes? There should be a reduced likelihood of alcohol-related motor vehicle crashes and deaths. Should be reduced alcohol-related violence, which is either gender-based or interpersonal. Should be reduced harmful alcohol-related non-communicable diseases. We can mention the cancers, the heart disease, and liver diseases. And it should reduce access and availability of alcohol to minors. There should be improved capacity of the healthcare system to address harmful alcohol use, improve regulation and enforcement of drinking laws, increase public awareness on the harms associated with alcohol use, and a 10% reduction in harmful use of alcohol by 2025. That should result in overall reduction of premature mortality due to non-communicable diseases by 1/3. There was also a projected impact over the next 15 years of what this policy would do. So we should have healthier, productive, and safer communities, families, and individuals. So approximately 600 lives will be saved. 23,000 health life years restored to Jamaican population. Return on investment of $1.6 on every Jamaican dollar spent. And avoidance of economic losses of over 2.6 billion Jamaican dollars. There were various steps that were taken towards policy development and implementation. So we had, as a first step, consultation with key stakeholders. Then there was engagement with the Pan American Health Organization as an observer, and also they gave their technical expertise. We had a policy steering committee established with representatives from a range of ministries, agencies, and departments. And of course, we had a cabinet submission for approval. This presentation was done to cabinet and was approved with very minor changes. So the next step now is the tabling of the national policy in the House of Parliament as a green paper. I must also mention at this point that we recognize that the statistics are information that we had on alcohol use nationally was a bit dated. So our Honorable Minister of Health has commissioned a new alcohol study that will look not only on the level of alcohol use, but also on its impact on the public health system in terms of costs, impact on the road deaths, road accidents deaths, and also looking at best practices where what programs have actually worked to reduce the misuse of alcohol. So this just shows the whole of government approach to dealing with this issue and all the various stakeholders that were involved in this process. So where do we go from here? So we have gotten cabinet approval already. Development of the white paper and consultation as the way forward. We table it, Parliament, and once that is approved and that hurdle is crossed, we go to public sensitization and education about what the new policy entails and what it means for the players, everyone, including the alcohol producing companies. And then, of course, we implement the policy. Thank you very much.
Thank you, Michael. And I'm conscious of the time, so I'm going to move on to a quick presentation on behalf of the HCC, just around how we are taking this global action plan and really trying to develop our own priorities, recognizing that there are limited resources and we do need to prioritize. And so from the perspective of civil society, where do we focus our advocacy efforts, right? Because you'd seen from Maristella's presentation, as well as Oystein's presentation, this is an entire package which has a number of different targets under each of the 6 action areas of the Global Action Plan. So what we've done is we've created a survey using the SAFER technical package as kind of the framework. And we've asked our membership, where do we think that we should focus our advocacy efforts over the next few years leading up to the 2025 targets, as well as the SDGs in 2030. And what we've found so far is that there is a general consensus that we should be advocating for a national alcohol policy, much like what we've seen Michael Tucker present from Jamaica. And then under each of the areas of the SAFER package, we've highlighted some of the priorities which our membership are coming back with. So under S, around strengthening restrictions on alcohol availability, what's come back as the priority here is establishing national legal minimum age for purchasing and consuming of alcohol. And we heard Rohan and Oystein mention that there may also be a need for exploring raising what the national ages are across the region. And a really important component here is also around enforcement of that national age. Under A, for advancing and enforcing drink driving countermeasures, the membership has come back with around restricting blood alcohol concentration limits with lower limits for novice and professional drivers. Under F, facilitating access to screening, brief interventions and treatment, we've got increasing the capacity of health and social welfare systems in order to deliver prevention, treatment, and care for alcohol use disorders, alcohol-induced use disorders, and comorbid conditions, And then under E, for enforcing banning or comprehensively restricting exposure to alcohol advertising to eliminate the marketing and advertising of alcoholic products, in particular to minors. And under R, raising prices, establishing a system for specific domestic taxation and alcohol and an effective enforcement system which may take into account the alcoholic content of the beverage. And then we can also think of in connection with this is how we can use the revenue generated from those taxes to drive public health initiatives. So those are the kind of priorities that we're seeing so far, and perhaps this can be discussed in the panel session. I also wanted to note that we will be expanding our consultation to wider stakeholder groups, and then we will be presenting these priority asks to heads of government across CARICOM. So with that said, I'm going to now hand over to Rohan to lead a brief panel discussion because we've got about 15 minutes left with the panelists. I'll invite Oystein and Maristella and Michael to turn your cameras on, and I will hand over to Rohan. Thank you.
So, Michael, you can put your camera on if you'd like to participate. I'm not sure what your time is going. But thank you very much, everyone. I think that certainly this has set the stage for work for the next few years. It's given us a lot to think about, and I think that our interactions now with our civil society is going to help us to decide how to best allocate limited resources for us to move forward. So I guess I want to throw it out to everyone. Where do you see us going forward from here? I mean, what should be our first steps? We have such limited resources. We've seen what our civil society is saying. If we had to pick one or two to work with, what would be your take on it? Maristella, Oystein, Michael, how do we best engage our governments and our civil society in terms of moving this whole ideas forward? As you see from what I presented, is very little action has been happening over the last 10 to 15 years in any of the major areas. We seem to have been stuck in a bit of a time warp. So I'd like to hear your thoughts on this. And if there are any thoughts from our participants, you can put it in the chat and we'll try to include it in our discussion.
So I may start a little bit. Well, I think the answer really should be with the NGOs that you work with. I think it's very important that we or ESPARO or or national governments even should not be telling NGOs what to do. I think a force of the NGO is in pushing for what you believe is right, and sometimes that differs from what we say or a government is doing. But having said that, I think what I think is important is to make more sustainable efforts. You have small resources, but as I mentioned, there are new opportunities now, and probably with to expand and seek for more funding to sustain and to build the capacity of NGOs to do advocacy work. There are opportunities that don't cost anything also, because they already exist, courses, especially now online, that people can take, and you can do online meetings and start this discussion with NGOs and people from civil society. In terms of pushing for policies, the more specific you are in each of these areas, the better, I think. So what is in terms of age limits, let's level off the differences between the countries. So one goal can be to every country have 18 minimum age. Of course, you can go to 21, but what is the low-hanging fruit to be at least to work? Those that don't have, they must establish, and those they're not enforcing at all, begin to work with NGOs to make that more visible with the media, and call upon the people to do their job when the law exists. In drink driving, I think is also an area that you need to have across the countries the same measure. That following WHO guidelines at a minimum should be at 0.05 for general drivers. Every country should have that in the law. Every country for novice drivers, either zero tolerance or very low, 0.02, and for professional drivers. This is also doesn't exist, and is one area that could help improve the situation if there is enforcement. Again, it shouldn't be just the law, but breath analyzers, training the police, working across sectors with the police, educating them on why their job is so needed, will go a long way, I think. It should not be on promoting safe driver programs, or they do not work. That's one of the points of our fact sheets, or even using Uber or just things like that. They overall do not work. So let's focus on what works and what needs to be done with the random breath testing, sobriety checkpoints. But we need to make it visible for the public, to implement that nudge that people know they could get caught. It goes a long way to have the media reporting on one or two events that they are getting someone, and it is in the news, and so people begin to think, well, it can happen to me, and change their attitude.
So important to raise the profile, because sometimes for months or so you read the newspaper, there's nothing on alcohol, it's just very quiet. But you're seeing the deaths, you're seeing the violence occurring very often in Trinidad around the rum shops.
Yeah.
No one talks about the rum shop, they talk about the violence. So very, very interesting. Oystein, what's your take on this? How do you see small countries like ours moving this whole global action plan forward?
Thank you. I think small countries like yours have an important role to play. And one thing is how you move things locally or in your region. But I think I would also encourage the Caribbean countries to continue taking a leading role on NCDs, including on alcohol as a risk factor in the global situation, because we know that the initiative and the movements from the Caribbean was really important in getting hold of the NCD process going back a couple of decades, and that is so important. But then, so I want to, acknowledge the role that your countries play and underline that even small countries can play an important role. But that said, and with the question you're asking about what can you do locally, I think that what we have had presented here today show that there is a lot to build on, that you can build on. I think that what Dr. Tucker presented from Jamaica is very interesting to see, and I think that Healthy Caribbean Coalition as a strong coalition in the region can build on that to also help move similar processes in other countries. And the first step that you have taken by doing the survey, which Maisha presented here now, is very interesting to see. So build on what is there, and I would also maybe repeat Maristella's suggestion to pick some of the low-hanging fruits, to start with those and then build on that going forward.
Thank you very much. Michael, what are your thoughts? Where do you see Jamaica? Do you see this really taking root, this whole policy? Do you see a lot of this whole government buy-in? What's the sense from the ground in Jamaica?
Okay, it's there without any doubt our health minister and the health network is committed and supports the policy wholeheartedly. The reality though, there is the toss-up between health and commerce, because alcohol is big money and big business. Every single promotion is centered around, parties are centered around alcohol, advertising centered around alcohol, a number of things. So therefore, what we have had to do, and where we sit in the National Council, we focus on two things. We mentioned NCDs for the more mature person that is targeted in terms of sensitization about what we call acceptable alcohol use within specifications. You look at the health risks associated with alcohol use. For the young person who does not care and think they're invincible, you look at effects on the brain and how it affects the young brain when you use alcohol. And therefore, in terms of the promotion and in terms of education, to support a policy like this, we try to make people aware of the risk factors associated for the various age cohorts. It's going to be a lot of pushback, even more pushback than this long process we have had with tobacco, because most people will accept tobacco is harmful without any doubt. I mean, it's nicotine, it's addictive, and what gets people involved. Alcohol is a different ballgame. Historically, the West Caribbean countries have grown sugar and alcohol in part of our culture, whatever, throughout the ages. And at this point in time, it is also associated with having fun, having a good time, and even maturity or being a man, being an amount of alcohol you can consume. And all of these things, significant challenge for us in the National Council when we're trying to do the prevention and work with various cohorts, especially young people. So what I'm saying, Rowan, is that there is a health network that is on board, and Maristela mentioned the NGO network. There are people who have their families have been affected by alcohol, loved ones have been affected. That grouping understands, and they will get the support from them. However, you get the complaints about people having to live. My business is based on alcohol sales. The parties we're having is based on alcohol sales or whatever. So that is a long and difficult role we'd have to travel in terms of making people understand that all the things that I had mentioned, regulating advertising, availability, a number of things, are things that are necessary for Jamaica as a whole to progress, and also for the health of the population. And that is foremost, as opposed to just thinking about dollars and cents.
Thank you very much. We're faced with some real challenges. I think that you really highlighted some of the key things. I don't know how we're doing for time, Maisha. I see we're closely approaching 12 o'clock. But if we had one more question, I think that, and it's the whole idea of where Oystein comes from, which is this idea of concept of alcohol and development, because, you know, all our governments think that there is a financial windfall to alcohol, but when we look at the economics, it doesn't show that picture. All the studies seem to suggest to us that alcohol has a negative impact when you look at the cost of the justice system, the healthcare system, the individual human development, that there's a hidden cost, and our governments are not acknowledging or seeing this cost. And I was really happy to see in some components of the Global Action Plan where they talk about the economic harm associated with alcohol consumption and overuse. And I think that that's something that maybe our governments haven't looked at critically, because I think that in small states like ours, with limited physical resources, that human resources become so much more important, and we must do everything. And I think that you pointed that out in your slides, that this is the aim, that we want to have healthy, happy populations who are going to be able to contribute to the development of our societies. All right, so Maisha, I see we have 2 minutes before the expected time of 12 o'clock. I'm going to turn it over to you. Thank you all for contributing your time and such interesting discussion. And I see our participants have remained at the same level. We haven't seen an exodus. It means that people have listened. I hope have taken away some interesting ideas, maybe some thoughts of how the civil society with which you work can make a difference, maybe utilize some of this information, maybe get in touch with us and see how we can work together moving forward. Maisha, thank you again.
Thank you, Rohan. Thank you, Maristella, Michael, and Oystein for joining us today. And thank you, attendees, as Rohan has said, for sticking with us throughout the webinar. We are really keen to build a strong civil society grouping around alcohol policy and accelerating policy implementation as we approach 2025 and 2030. I'd like to thank many of you who attended today and participated. Please look out for our stakeholder consultation communications over the coming months. And we encourage you to participate. Also, please reach out to us directly if you have any specific interest. I noted Michael's comment. You know, there are many organizations which are not traditional NCD NGOs and part of the HCC network, but are very interested and keen in this area of alcohol policy. And we encourage you to join HCC, because this is an often neglected area of the NCD response, but very much an important one. With that said, we thank you again. We've got about a minute left. Thank you for joining us. Enjoy your weekend, and please continue to support this agenda.